Good morning and welcome to Last Look Live. I'm Kate Breslin and I'm the president and CEO here at the Schuyler Center for Analysis and Advocacy. And I'm joined by our fantastic team here, small but mighty, at the Schuyler Center, and each one of them will introduce themselves as they begin. So every year, we take a look at what's in the executive budget, and then that typically comes out in the second half or so of January, and that's our first look at the budget, as we call it. And then when each house of the legislature introduces their own budget bills, we take our next look at the budget and compare the executive budget against what we see in each of the one house budget bills. And then after the budget passes, we do what we call our last look at the budget. And in each of those, those are an assessment of what we see in the budget documents in the context of Schuyler Center's priorities, which focus on shaping public policy for people in need across New York. So the budget process this year went a little long. New York's fiscal year starts in April, which is a little bit unusual. So the expectation is that the state budget will pass before April 1, before the start of the new fiscal year. And as probably most of you here today know, it went long, and the budget didn't actually get finalized until just about a week ago. So it went till May, and I'm one of the folks who can tell you that this isn't the longest it's ever gone. I've been here in August when we're still trying to see a final budget. So and so now that the budget is passed, we'll be focusing a lot on implementation. Implementation matters. So we'll be doing that as we start to gear up for thinking about what priorities should be for next year's budget. And I couldn't start without calling attention to the Child Poverty Reduction Act, which was passed which was chaptered about a little over a year ago in the first part of 2022. And the Child Poverty Reduction Act passed both houses of the legislature near unanimously with rounding bipartisan support. And it commits the state to cutting child poverty in half in about 10 years with attention to racial equity, because we know that our children of color are much more likely to be experiencing poverty, and all of its negative consequences than are their white counterparts. So we were very focused this year on, in this first budget year since the enactment, first full budget cycle, we were very focused on what are the things that can happen in the budget that could have an impact on child poverty. So one of the things that happened this year is that there was an expansion of New York State's child tax credit, and it was really fixing an error that was made when New York's child tax credit was enacted. The federal child tax credit, when it was expanded a couple of years ago, that we have fantastic data showing the significant impact it had on child poverty, and on just families' day-to-day lives. And so in case we needed it, we had very clear data that showed that expanding the child tax credit can have a significant impact on poverty. And New York's child tax credit has, ever since it started, it excludes children who are under 4 years old. So the poorest kids in our society, the most racially diverse kids in our society, are those who don't qualify for the child tax credit. And this year, we, and it's been somewhat widely reported, the legislature and the governor agreed to include those babies in the child tax credit. And so this really fixes a glaring omission in our child tax credit. It's a big deal. It means that somewhere between 600,000 and 900,000 babies will qualify for the child tax credit going forward. We had hoped to see some changes in the child tax credit that would allow those with the lowest incomes to receive the full tax credit, and that didn't happen this year. The full tax credit being $330 per child per year, and we know that families, certainly those living at the margins, need more than that. So we in order to have the biggest poverty reducing effect, the child tax credit needs to get to the lowest income people, and the amount of it needs to be increased. With that, I will turn the mic over to Crystal Charles.
Good morning, everyone. I'm Senior Policy Analyst for the Schuyler Center. And today I'll be going over the child welfare related budget updates. So the first and most encouraging is an update to the child welfare housing subsidy. So this housing subsidy is available for families that become involved in the child welfare system and for youth in foster care that are reaching an age where they can transition to independent living. And it was established back in 1988. It was available for $300 a month for 3 years. And then it stayed that way for until this year. So we're excited to share that this housing subsidy was increased to $725 a month. And this is encouraging because, you know, New York is in the middle of a housing crisis right now, and housing is one of the largest bills that people have. And so poverty is one of the factors that bring families into involvement with the child welfare system. And so this housing subsidy being more effective at $725 a month will have a better impact on those families and on the youth in care that will be using it as they transition out of the child welfare system. Unfortunately, the budget didn't include two other pieces that we were looking forward to seeing updated for the housing subsidy. So one piece was increasing the maximum age to 24 for youth in care. In New York, youth can stay in foster care until 21. So approximately half of the youth eligible for using the subsidy wouldn't be able to use it because they're in care until age 21, and currently the subsidy is only available until age 21. The other piece that wasn't included in the final budget is indexing the monthly amount to inflation. And as we all know, we're dealing with an inflation crisis right now. And so including an update to index the amount to inflation would help this subsidy continue to be effective moving forward. Another update has to do with the funding that helps fund services like the housing subsidy, preventive services, and child welfare. These can include childcare, transportation, home visiting, job training, and even cash grants. And these have been funded at a 62% reimbursement rate. Even though in statute it requires a 65% reimbursement rate. And originally, when this funding stream was established, it was at 75% reimbursement. So that 62 reimbursement has remained unchanged in this final budget. So another change to the budget is a cost of living adjustment for human services workers. In this budget, it was 4%. And that's just for the coming year. Last year's cost of living adjustment was 5.4%. So this year's is lower than last year's. And there were some workers that were left out of this, including child welfare preventive services workers and child health home workers. So the other two pieces I'll cover before I pass it to my colleagues is some pieces that just were not included. So part of that is a child and family well-being fund. So this would have funded projects in local communities that would be community-led, and the money would have gone to smaller kind of local organizations that provide some of the concrete supports that are needed and wanted by families experiencing poverty and neighborhoods that have historically experienced child welfare involvement. And finally, I'd like to touch on the Foster Youth College Success Initiative. This initiative grows every year as outreach improves and new cohorts enter school. So this initiative helps support youth who have experienced foster care as they enter college and go through their time in college, and help support their continuation and graduation. And so this year's final budget does not include an increase to this initiative in funding, despite projected increases in need in the coming school year. With that, I'll pass it to Katie.
Thank you so much, Crystal. I'm Katie Albitz. I'm a policy and communication specialist, and I'm pretty new to the Schuyler Center, so this might be your first time seeing me. I'm going to talk about childcare today. And if you want more information on pre-K or after school, I'd encourage you to take a look at Last Look, because I'm only going to be touching on the highlights of childcare today, but there's a lot of different modalities and intersections between childcare, preschool, and after school. So just want to encourage you to take a look at the Last Look for more details there. On the big top line, policy wins for childcare. First and foremost, we were advocating along with our colleagues at the Empire Child for a big increase in workforce compensation for childcare workers. Childcare workers in New York State make less than 97% of occupations across the state, and there have been other states across the country, including Washington, D.C., that have taken some really big strides to move childcare workers out of poverty and into a path to a sustaining and thriving wage. So with that, this year, the budget contains $500 million for workforce retention. This will be similar to the previous stabilization grants that New York State distributed using American Rescue Plan and other federal dollars. However, this does contain an additional $110 million in state funds. For families, there were wins as far as eligibility, access, and breaking down barriers. So the first one would be that right now across New York State, families receiving up to 300% of the federal poverty, or earning 300% of the federal poverty level, are able to access assistance to pay for childcare. The governor proposed in her executive budget to raise that to the maximum allowed under the Child Care Development Block Grant federally, which is 85% of the state median income. And right now, that is $93,000 for a family of 4, and that did make it into the final budget. Additionally, a huge burden that's going to be lifted for families is capping copays at 1% of their income over the federal poverty level. So that's 1% of the income a family of 4 earns over $30,000. Right now, that copay could be a really large burden that's based unevenly across the state on sort of a county by county basis. So this standardization and this cap at 1% is really going to help families afford childcare even when they're getting assistance. Sometimes childcare was not affordable. Another increase that's going to help childcare providers and promote stability is increasing absences to 80 per child per year. And this is really big, I mean, of course, in the context of the COVID pandemic, but also because the earliest years of a child's life are the years where they're most likely to need to be absent for any variety of reasons. And childcare programs, their bottom line shouldn't be penalized for those reasons. So having up to 80 absences really will promote stability for programs and really encourage them to take these children and these families that are receiving subsidies. Finally, as far as the bigger policy wins, currently there are children across the state who are income eligible because of their family's salaries, but they're actually disqualified from childcare assistance that their families need solely due to their immigration status or the fact that their parents work episodically or seasonally. There will be a pilot program that was included in the budget of $1.4 million in New York City and $4 million outside of the city. And that will be in order to allow those families to begin to receive the child care assistance they need. And finally, as far as the breaking down barriers for more families, New York's going to really come into the 21st century with the promise of an online application to be able to access child care assistance. And that will be a statewide initiative. And also there will be some barriers broken down for those families who are already receiving benefits such as SNAP, Medicaid, or other benefits. They'll be considered categorically income eligible, and that'll take away a few of those steps that make it harder to access childcare assistance. And with that, I will pass to Bridget and Lara.
Thank you, Katie. As always, there's many aspects to the health budget to cover, but we only have time for a couple today that we think of are of particular importance for young children and families. So I encourage you to look at the last look document for more information on what we can cover right now. The Schuyler Center and our colleagues at the Kids Can't Wait campaign are disappointed that the 11% increase in the early intervention payment rate was not included in the final budget. While the lack of providers in early intervention is widely acknowledged as a crisis impacting families in every region of the state, there is now a risk that more professionals will leave the EI program and additional children and families will be left waiting for services. Some of this is because the state has not provided a program-wide increase in reimbursement rate in decades. And although the rate increase did not make it into the final budget, we do want to acknowledge that the Senate and the Assembly included the rate increase in their one House budgets for the first time. We're grateful for this addition and we'll keep up the pressure for next year. The budget does include $2.5 million for a study of a new and better ways to fund preschool special education programs. This study will be an important step towards transforming the complex and inadequate funding for preschool special education programs now. The Schuyler Center and the Kids Can't Wait campaign hope that the study will result in more classroom seats and more young children receiving the instruction and supports that they need. The Schuyler Center coordinates a statewide work group that brings together maternal, infant, and early childhood home visiting programs. And we share information and consider policies to improve access and strengthen these services. We're really pleased this year that the budget maintains funding for such programs as Parent Child Plus, Healthy Families New York, Nurse Family Partnership, and the Maternal, Infant, and Community Health Collaboratives. And I'm going to just quickly mention another proposal that we think is an exciting opportunity for maternal and child health. The budget expands Medicaid reimbursement to community health workers, providing services to children and adults with health-related social needs, as well as to licensed mental health counselors, licensed marriage and family therapists, and licensed social workers who provide services in clinics, including community health centers. And this proposal will require the state to submit a federal Medicaid waiver, but we look forward to the impact that these new services will have on maternal and child health system. And with that, I will turn it over to my colleague Lara from Medicaid Matters.
Thank you, Bridget. Good morning. I'm Lara Kassel. I'm the coordinator of Medicaid Matters New York, the statewide consumer advocacy coalition housed here at the Schuyler Center for Analysis and Advocacy. And this year's budget includes a win. Medicaid Matters is celebrating a win in this year's state budget. We are very excited that this year's state budget will create an independent advocacy assistance program for people with intellectual and developmental disabilities. This is a program that we have been advocating for several years. It is modeled after programs that already exist in New York for other groups of people, including people with substance use disorder, people who are covered by managed long-term care, and a variety of other programs. And this new program, which was funded by the governor in the executive budget, will be created specifically to serve people with intellectual and developmental disabilities. We do have some work ahead of us to make sure that the program will be independent, that it will operate independently, that it will include the functions and duties that will really make a meaningful difference to people's lives and to the system overall. And those include things like data collection and reporting, allowing the program to support people to appeal should they be denied a service, for instance, and a variety of other functions to make it a real meaningful program that will make a difference, and that it be accountable to the people that it was intended to serve. So I'm going to stop there in the interest of time. You can find Medicaid Matters online and on Twitter, and I'm going to hand it over now to Dede.
Thank you, Lara. Good morning, everyone. My name's Dede Hill. I'm Policy Director at the Schuyler Center. So my role today is to talk about life after the budget. There is a lot more work to be done. As my colleagues have already discussed, this budget, it was marked by many achievements, many wins for New York children and families and low-income New Yorkers, but it also left a lot undone. And it came with compromises that will carry real life impacts for New York children and families, some of whom were left without access to essential services because of these compromises. But happily, there is still a month left of legislative session, and we will be spending that month fiercely advocating for a number of bills that would build on the achievements of the budget and right some of the budget's shortcomings. So I'm going to talk about just a few of our top legislative priorities and refer to you in the chat to our full list. So first, in the area of child welfare, we are asking New York leaders to finish the work related to the child welfare housing subsidy program. As Crystal highlighted, we achieved really important increase in the monthly subsidy amount in the budget. And but post-budget, we are asking lawmakers to extend subsidy eligibility to youth aging out of foster care from the current age of 21 to age 24. The state has a special responsibility for these young people, and it should be there to help them at the exact moment that they are striking out on their own. It's a moment when we know all young people experience bumps on the road and as they transition to independence, and New York should be there to support them during that transition. Another top child welfare priority is a bill requiring medical care providers to obtain the informed consent of pregnant people and new mothers before they or their babies are drug tested. Black women in New York and around the country are drug tested disproportionately, and this can lead to a disproportionate number of calls to child welfare, and it can sometimes lead to harmful family separations at or near birth, at the moment when mother and baby are bonding. Informed consent is already in effect in New York City's public hospitals. It's time to extend this rule statewide. Just a few more. I have to talk for a moment about childcare. We are prioritizing legislation that would require all counties all around the state to pay a 15% higher childcare reimbursement rate to childcare programs when they are serving families experiencing homelessness and when they are serving children whose parents are working non-traditional hours, so evenings, nights, weekends. Care for these families is in high demand. And it is more costly to provide. And so we are calling for this higher reimbursement rate to be extended around the state. It is not enough to address the severity of the shortage, but it is a really important step. And then finally, in the area of health, we are prioritizing a new bill to allow additional healthcare providers and parents to apply fluoride varnish to children's teeth. This is a super simple and wildly effective bill. It would significantly increase access to this important preventive service. And passing the bill this session is really urgent for many communities, but I want to little shout out to Buffalo, where it just came to light that fluoridation in the city's water was halted 8 years ago with very little notice to the community. So this bill would help get fluoride quickly on the teeth of the many children who have gone without for so many years. Again, I'm going to refer you to our full list of priorities. There are many more. We hope that all of you will join us in lifting up these priorities in the coming weeks. I will also note that we are not just going to be pushing these legislative priorities. We will be working to ensure effective, equitable implementation of the budget and these bills that we hope to see passed, because we know that budgets are just numbers. Legislation is just words on a page until they are implemented and the impacts are felt by the families and children for whom they are meant to benefit. So with that, I am going to close us out. Thank you so much for tuning in today. We look forward to working with all of you and with all of our partners, our advocacy partners, our government partners, to make New York a stronger, more equitable and just state. Thank you.
Thank you.
Thank you.